The political parties, 3 of them are promising to introduce universal pharmacare. The Liberals would spend $6 billion over 4 years to take steps towards a universal pharmacare program, but the money would also be used to improve access to family doctors and expand home care and mental health services. The NDP promise a pharmacare for all plan covering all drugs approved by Health Canada. They say it would cost $10 billion annually and would be in place by the end of 2020. The Green Party would introduce universal pharmacare by next year, and their plan, they say, would cost nearly $27 billion in the first year, the single biggest ticket item the Greens promise. The Conservatives would not bring in universal pharmacare. They'd focus instead on Canadians who are not covered provincially or are covered by private drug plans at work. In 2017, a Parliamentary Budget Office report estimated it would cost the federal government $19.3 billion to implement a national pharmacare program. Putting one in place needs buy-in from the premiers. Healthcare delivery is a provincial responsibility. As Mike Drolet explains, a national pharmacare program can't come soon enough for the growing number of Canadians who can't afford the drugs they need.
Everyday Canadians of all ages go through the routine. Pills.
These are just the needles that goes with the pen.
Needles, whatever they've been prescribed to treat what ails them. But while Canada has universal health care, the lack of a pharmacare plan has forced many like Sophia Chamsi to make a choice: food and rent or new needles for every dose of insulin to treat her type 1 diabetes.
I also ration insulin, like I can't eat certain things. I try to ration my dose per day so that my insulin lasts longer and my supplies last longer.
Like many of her peers, she moved from contract to contract, unable to get that full-time job with benefits until recently. So for 5 years, she had to pay out of pocket $400 a month for medical costs.
I come from Morocco, and I got insulin there for free. So when I moved to Canada, I was under the impression that it would be also free, given that it was invented here and it's, Canada's gift to the world. But unfortunately, it wasn't.
The hospital expenses of any one of us will be borne and paid for by all of us.
It certainly wasn't Tommy Douglas's plan when he created Canada's universal healthcare system. Dental and pharmacare were supposed to be introduced later, except they never were. And now 10% of Canadians aren't filling their prescriptions, and far more are resigned to having to pay for their drugs themselves.
I certainly don't take it as this is the way it has to be. I know it can be better, but for me, I've figured out this is just the way that it is for me, and I am finding ways to make it work.
Canada is now the only developed country with universal health care that does not have national pharmacare.
The thing is, and we need to stop studying this issue. This issue has been studied way more than it should have been, and it is very clear in terms of which model is the most efficient, and this is universal pharmacare. This is where we need to go.
It was Tommy Douglas's dream. Can any of the parties untangle the mess it's become?